Can you explain what you would do for someone if they had neck or shoulder pain?
Like Giselle,
Yeah.
she has little neck tension, neck
Yeah.
pain. Please turn around, come to the side so we can see that better. So when you look to the side way, you can see where the line is, where she stands, where it's more tension, where it's less tension, if one shoulder is forward or the other, or higher or lower, or if the head is tilted or straight. Her head is pretty straight, her shoulders are pretty level, but you see there's a little bit of a tension here in the neck area because of a slight lordosis here. And when I touch her there, I feel like there's a little bump in there. So this is around the third and the fourth and the fifth cervical vertebra. So we're gonna reduce the tension there. And this is always connected with the upper back because here you can see that it's a little water, which means the lymphatic system cannot drain the water, which is the toxic detoxification system of the body. Can't really drain the water away, which has to go from here into the armpits. It goes underneath the collarbone called terminus, and from there it goes through the bloodstream out. So because of this water here, the first thing I would do, I would start right here in the collarbone to activate the pump of the water, basically, of the lymphatic system, to drain this water out as well underneath the armpit. So there's an activation going on, because if there is water, there is a stagnation, and if there's stagnation, there is not a free flow and not enough space to heal or release whatever tension she has there. When I lift up the skin, you can see like it's harder to lift up here because of the toxins, but easier to lift up here. Like when I try, like it's a bit hard, it's a bit thicker here, it sticks a little bit to the bone. See that? I can make it smaller, but here I can have it smaller. You see that?
Mm-hmm.
So that's all an indication that there is some stagnation going on in her back. So starting with like rolling the skin and activating the blood circulation right underneath the skin. That would be important as well. Bring please your feet together completely, touching, just to see like if there's an imbalance maybe coming from down here, and that's why she has symptoms up here. For example, seeing how she stands, looks good. Both feet go a little bit inside, which is okay, don't worry. I'm gonna see if there's a length difference. Hard to see with this pants, it's okay. Yeah, bring it out if you can. Because I have the feeling the right one is a little bit longer than the left one. Oh yeah, very clearly. Can you see that? These 2 points here?
Yeah, the right side's way higher than
The right side is way higher. So what does it mean? There's either an imbalance in her hips. Here the right side is still a little bit higher. So I'm on the grease of gluteus maximus muscle to see. That's good, I can tuck it in even here. But it's less here, so there's a compression somewhere in the hips. So when I go to the crista iliaca, which are the hip bones, I can still see if there's a difference, and it looks very similar right now, generally said. Then I can go to the spina iliaca, posterior superior, and I can see that the right side is a little bit higher, but not much. Front. The front is way higher. So what it means, there's a rotation going on with her femur head somewhere in her hips. And that can cause a slight scoliosis, which you haven't seen yet. A little bit here. My left thumb is prominent compared to the right thumb. And here's the right thumb. So there's already like a little slight scoliosis. It looks like an S scoliosis. This can cause a lot of problems in your neck, because if you shake a stick, the ends move the most. So if there's a compression, there's a compression. And because of these two compressions, there is no movement. Shake a stick in the middle, no movement, and the lymphatic system can flow away. So now we've found the cause. Comes from the root down here.
So how would you treat that?
I would treat it first with lymphatic drainage, then starting to align her posture, which would look like, especially when it comes from down here, with Dornbreus. This is like a technique from Germany. It's like an alignment and mobilization of the joint and spine. If you want, we can start now and do that. And after, if that is aligned, then I'm gonna work with the muscles, because a muscle moves the bone and never the opposite way unless we have an accident. So it's easier to correct the bones, but much harder to correct or to stretch the muscle in a certain position, increase the blood circulation. It takes more time, more effort, but it pays off at the end because it leaves the bone where I correct or like I brought it into position. Does that make sense?
Yeah.
Good.
Thanks, Giselle.
Also, after that, of course, this is the symptoms she has, which means, and definitely work on her back. After the liquids are drained, it can take a few times of sessions, but if that is drained, I'm gonna work on the muscle, on the neck with an Indian head technique. A technique like Haki, it's like stretch and relax. It's like a physiotherapy poet from Austria who figured that out. It's like having the head in a certain position and stretching the muscles, tendons and ligaments in a certain way and see how she reacts. Craniosacral is a great technique to release tension up here. And maybe a little bit of face, jar. I also see like the sternocleidomastoideus muscle is very tight, so that can cause a lot of pressure up here in her neck. Trying to correct that symptom. That's it.
Thanks.